Today's drug is furosemide. Brand name, Lasix. The therapeutic category is an antihypertensive or a loop diuretic. Dosage form and strength. The medication comes as a tablet in a 20 mg, 40 mg, and 80 mg strength. It also comes as a solution in an 8 mg per milliliter concentration, as well as a 10 mg per milliliter concentration. Another dosage form is the injection. It comes in a concentration of 10 mg per milliliter. Indications and dosing for adults. The first indication is for edema. Regarding oral dosing, the range is between 40 and 120 mg per day. Initiate between 20 and 80 mg by mouth for one dose, then increase by 20 to 40 mg every 6 to 8 hours with a max of 600 mg per day. Regarding intramuscular or IV dosing, the range is 20 to 40 mg intramuscularly or IV for one dose, then increase by 20 mg every 2 hours, or you can initiate at 0.1 mg per kilogram per dose intravenously for one dose, then 0.1 mg per kilogram per hour, followed by doubling the dose every 2 hours, up to 0.4 mg per kilogram per hour. The next indication is for acute pulmonary edema. The general dosing is 80 mg intravenously every hour. When initiating, start at 40 mg intravenously for one dose. Another indication for adults is hypertension. The general dosing is between 10 to 40 mg by mouth twice daily. When initiating, start at 40 mg by mouth twice a day. An off-label indication for adults is in hypercalcemia. General dosing is at 120 mg per day by mouth, divided 1 to 3 times a day. Another dosing regimen for hypercalcemia is to initiate 80 to 100 mg intramuscularly or intravenously every 1 to 2 hours, and this is given with saline. Indications and dosing for pediatrics. The first indication is for edema. In neonates, regarding oral dosing, the dosing range is between 1 to 4 mg per kilogram by mouth, 1 to 2 times daily. Initiate at 2 mg per kilogram by mouth for one dose, then dose increases of 1 to 2 mg per kilogram per dose every 6 to 8 hours. The max dose is 6 mg per kilogram per dose. Regarding infants and children and oral dosing, the dosing range is between 1 and 6 mg per kilogram by mouth every 12 to 24 hours. Initiate at 2 mg per kilogram by mouth for one dose. Increase the dose by 1 to 2 mg per kilogram per dose every 6 to 8 hours with a max of 6 mg per dose. Regarding neonates and intramuscular or IV dosing, the dosing range is between 0.5 and 1 mg per kilogram per dose intramuscularly or intravenously every 8 to 24 hours. Initiate at 1 mg per kilogram per dose for one dose, then increase by 1 mg per kilogram every 2 hours. The max dose is 2 mg per kilogram per dose. In infants and children, regarding intramuscular and IV dosing, the dosing range is between 0.5 and 2 mg per kilogram per dose every 6 to 12 hours. Initiate at 1 mg per kilogram per dose intramuscularly or intravenously for one dose, then increase by 1 mg per kilogram per dose every 2 hours. The max is 6 mg per kilogram per dose, or 0.5 mg per kilogram per hour with titrations based on the clinical response. An off-label use in pediatrics is for hypercalcemia. The dose range is between 25 and 50 mg intramuscularly or intravenously every 4 hours administered with saline. Mechanism of action and pharmacology. The mechanism of action for furosemide is that it interferes with the chloride binding cotransport system, causing a natriuretic effect. Furosemide inhibits sodium and chloride resorption in the ascending loop of Henle and proximal and distal renal tubules. The drug is minimally metabolized hepatically. 50% oral and 80% IV is excreted in the urine within 24 hours, and the rest is excreted in feces as the unchanged drug. The onset of action for diuresis occurs between 30 and 60 minutes. Symptomatic improvement of acute pulmonary edema usually occurs within 15 to 20 minutes. A peak effect is seen in 1 to 2 hours and 0.5 hours if IV. The duration of action is between 6 to 8 hours orally, or if taken IV, around 2 hours. In patients with normal renal function, the half-life elimination is between 0.5 and 2 hours. If the patient has end-stage renal disease, it's around 9 hours. Furosemide is between 91 and 99% protein bound, primarily to albumin. Special populations and considerations. In patients with renal impairment, it is contraindicated. In hepatically impaired patients, dosing is not defined, but caution is advised. General caution is observed in patients with electrolyte imbalances, in elderly patients, in premature neonates, in severe renal and hepatic disease patients, and patients with gout, SLE, or diabetes. In regards to pregnancy and lactation, fetal harm is not expected but a possible risk. Consider alternatives when breastfeeding, though risk is not expected based on the drug's properties. Side effects. General side effects are increased urinary frequency, dizziness, lightheadedness, headache, blurred vision, abdominal cramps, constipation, nausea, vomiting, and diarrhea, orthostatic hypotension, and bladder spasms. There is a black box warning for fluid and electrolyte loss. A potent diuretic in excessive amounts may cause profound diuresis with electrolyte and water depletion. Doses should be individualized and scheduled under medical supervision. Drug interactions. Some general concerns is furosemide is an OAT1 and OAT3 substrate. This may cause hypocalcemia, hypokalemia, hyponatremia, and other ailments. Drugs to avoid are armodafinil, budesonide, caffeine, clonidine, lithium, prednisone, aspirin, as well as others. Monitoring parameters. Blood, urine nitrogen and creatinine, serum CO2 levels, electrolytes, platelets, urine, and blood glucose. Patient counseling information. Furosemide is used to treat fluid retention and hypertension by preventing the body from absorbing too much salt. Do not use if unable to urinate or have kidney disease, enlarged prostate, bladder obstruction, gout, lupus, or diabetes. If a dose is missed, take the medication as soon as you can, but skip the dose if it is almost time for the next dose. Do not take 2 doses at a time.